Welcome back. So this is part 4 of the recent graduate webinar about blocked dogs. So we've talked through how we try and unblock this dog and how we deal with the stones if we're able to flush them back into the bladder. And this section is going to focus on what we do if we can't flush the stones into the bladder. So if they're stuck in the urethra and we absolutely cannot get them to shift. So there's a couple of options available. The first is to do a pre-scrotal urethrotomy. And then obviously for this dog, because it's got a stone in the bladder as well, you would have to do a cystotomy as well to remove the bladder stone. And the other option is to do a scrotal urethroscopy. So the main difference between those is the pre-scrotal urethroscopy is a cut into the urethra to remove the stones, whereas the urethroscopy is creating a permanent opening in the urethra. So the main time you might choose to do urethroscopy rather than uretherotomy is if you think this dog's likely to re-obstruct. You know, if there's an underlying reason why the dog is forming stones and you think you're unlikely to be able to resolve that long term, and particularly if the owners aren't going to be able to afford multiple surgeries, then you might be better off going for a scrotal urethroscopy, because then you're opening up the wide portion of the urethra out to the outside world. And then in theory, those dogs are less likely to obstruct in the future, a bit like doing a perineal urethroscopy in a cat. So starting with the uretherotomy then, so this is doing the cut into the urethra to take that stone out. So I'd say this is probably uncommonly performed, particularly by us at a referral level, because a lot of people aren't that satisfied with the procedure and there are complications that we'll come on to. So as I said already, really we're going to aim for retrohydropulsion back into the bladder. But if that's not possible, then my concern about doing the uretherotomy is firstly the complications that we come across during surgery and post-operatively, but also the fact that even if it all goes well and that urethra goes on to heal nicely, you're quite prone to getting strictures, and you're often doing this procedure in an area where the urethra is already narrowed at the base of the os penis, and if you get a stricture on top of the already narrow part, then those dogs are much more likely to re-obstruct in the future. So definitely I know people that do it and they're very happy with it, but for me, going straight for a urethroscopy is probably the safer option. So for doing the uretherotomy, you're going to have the animal in dorsal recumbency, clip and prep as normal, flush out the prepuce just to get things as clean as you can. If you can place a urinary catheter, a bit like for doing a PU in a cat, that does make the surgery easier. Even if you can only get a really small one past the obstruction, that will help. If you can't do that but you are opening the bladder, you obviously do have the option then of passing a catheter norma grade, and you can still get it in the urethra that way. We're then going to do a midline incision, and you're going to do that in the pre-scrotal area, so between the base of the os penis and the scrotum, same sort of area where you do a pre-scrotal castrate. So it's going to be a midline incision. You'll then identify the retractor penis muscle. You need to pull that over to the side. And then if you've got your catheter inside the urethra, you should be able to palpate the catheter in the urethra. And at that point, you do a nice sharp incision with a number 11 blade onto your catheter. And you can then extend that with iris scissors as necessary, and you can then hopefully find your stone and fish it out. If you can't catheterize the dog, the risk with doing that incision is that it's quite easy to then cut the dorsal wall of the urethra, which is obviously what you want to avoid. So we'll try and just cut into the urethra and then extend it with the iris scissors just to make sure that you're not causing damage. When it comes to closure, the reason I put the question mark is actually one option is not to close it. So you can just leave these incisions open. Obviously some urine will come out of the hole while it's healing, but actually it will then heal by secondary intention, and a lot of these in theory should go on to heal quite nicely. If you do want to close it, then make sure that you definitely can identify the edge of the urethra and close that with something probably short-term absorbable like monocryl, just in a simple continuous pattern, and then intradermal or skin sutures, whatever you would normally do. So as well as stricture, one of the other risks of this surgery is you get some leakage afterwards. So this was a dog that had a pre-scrotal uretherotomy. This one was closed, and you can see from the picture it's quite gruesome, but this dog has had a lot of urine leak out of its urethral incision into the surrounding areas. And that's why it's massively swollen. You've got bits of skin starting to slough off and a lot of inflammation. That's just because you've got this quite irritant urine that's leaked subcutaneously into the prepuce and the penis and the surrounding area. And actually when you extrude this penis, you can see the whole penis has become quite necrotic. And so at this stage, this is something that you can't really salvage. And so we did then convert this case into a urethroscopy. And I'll use this case just to show how you would do a urethroscopy. So when you're doing a urothrostomy, you're doing a cut into the penis, and obviously, as you can imagine, there will be some bleeding. So the things that you can do to try and minimise that is to try and keep as close to the midline as possible. You've got the corpus spongiosum on each side and the corpus cavernosum, and so the closer you can keep to the midline, the sort of smaller those areas are, and therefore the less bleeding you're going to get. A bit like the scrotal urothrotomy, we're going to try and avoid incising that dorsal wall, because again that's likely to bleed. And then once you've done your incision, it's then just a case of doing quite delicate sutures to get a really good anastomosis between the skin and the mucosa of the urethra. So as I said, for this dog we had to remove the penis, and that's what we're doing here. But then once we got beyond that point, we're then at the stage where we can start to do our scrotal urothrostomy. So this is what we'd essentially have if we'd gone straight to a urothrostomy. So the first thing to do in an entire dog would be to do a castration and a scrotal ablation. And if it was already neutered, you'd just do the scrotal ablation, and you'd be in this sort of situation now. So when we're doing that, you need to make sure you don't remove too much skin, because you don't want too much tension on your suture lines. So normally if we pick up the scrotum, you're going to do your incision about half a centimetre or so away from where the crease is between the scrotum and the skin of the thigh. So just a little bit up into the scrotum, just to make sure there's no tension. Obviously you can always take more skin off if you need to, but you can't put it back once you've removed it. And then when it comes to doing the sutures, I would normally do a simple continuous suture on both sides, just using something that absorbs quite quickly. So again, for example, using monocryl. And you just need to be quite careful of these sutures. So you want to make sure that there's quite small bites between them, so usually only a couple of millimetres apart. You want to make sure that the suture through the skin is quite superficial. So if you were to go full thickness, you're not going to get great apposition between your mucosa of your urethra and your skin. So you want to make sure that you're taking very superficial bites of the skin, just through the epidermis and the superficial dermis. And then again, a relatively small bite from the mucosa, because actually the tissue is quite tough, the sutures don't tend to pull through. And the better you can get that apposition, the less bleeding you're going to get afterwards. And so it is important just to take some time doing that and do them quite carefully. And if you have got any gaps between your sutures, you'll normally know about it because there's bleeding during surgery, and you can put extra sutures in as and when necessary. So you're going to do 2 simple continuous sutures, 1 on each side, and you want to make urothrostomy usually around 5 to 8 centimetres long, depending on the animal. And that is quite long, but actually this will reduce by around 50% as it goes on to heal. So you want to intentionally make it bigger than you need to at the start. Once you've done your urothrostomy, there might then be some extra areas of skin that you need to oppose. So you can see on the picture now, this is the finished urothrostomy, and obviously you can't stretch this urethra to fill the whole skin defect, so we're going to place some skin sutures as well. That's what was done here at the end. So you can see it's quite a big hole, but that is intentional because we know that it's going to get smaller as it goes on to heal. So the main complications we see with scrotal urothrostomy, the first one is definitely bleeding, and that can be quite significant. So there has been occasion where dogs have needed blood transfusions because they do carry on bleeding after surgery. And what we usually see is it will start to settle down, then the dog will get a bit excited, or it'll go and have a wee, and then it will start bleeding again. And the bleeding can look quite dramatic, so it is squirting at you, a bit like an artery. There's that pulsatile squirting of blood. But it is just a case of reassuring people, that is normal for these cases. It will settle down, putting a bit of pressure on if you need to, and keeping the dogs as calm as possible. Another risk can be dehiscence. If your sutures do start to pull apart, the main problem with that is firstly you're going to get secondary intention healing, which can cause your urothrostomy to stricture or stenose. But also you can get urine leaking under the skin, and that can cause skin sloughing and all sorts of other problems. So if you do get dehiscence, this is something that we might want to re-anaesthetise these animals to resuture them depending on the cause of the dehiscence. Because you're shortening the urethra and making it wider, these animals are a little bit more prone to getting UTIs. That's something to monitor going forward. And also they can get urine scald on the skin. So often these dogs will learn to squat when they urinate rather than cock their leg. But in that interim period, they can get urine dribbling on the skin surrounding the urothrostomy. So if that is happening, we tend to just put a bit of barrier cream, so something like Vaseline, around the urothrostomy just to keep the skin protected. And then lastly, I put recurrent obstruction, though that is usually less of a problem after a scrotal urothrostomy. One of the things we do here with the dogs that are regular stone formers, if we know we're not going to be able to stop those stones forming, is that we would try and image those cases fairly regularly. So maybe ultrasound the bladders every few months and see if more stones are starting to form, because if you do identify them early enough, you can do voiding hydropulsion to get rid of those stones from the bladder before they get big enough to cause a problem. So that's the end of our webinar on block dogs. I hope you found that useful. Please do remember that the recent graduate programme as part of the Langford Academy is free to join, so go to the Langford Academy website, the URL's there at the bottom, and click to sign the recent graduate scheme. And please do subscribe to our channel, because the more subscribers we get, the more funding we get, and also you'll be the first to know as and when new videos are uploaded. Thank you.